Hello guys, welcome and welcome back to my channel. As you all know, my name is Joy Do. So in this video we'll be talking about health talk, an interesting topic. You don't want to miss it, you don't want to go anywhere, so please stay and watch to the end of the video. Thank you very much everyone that subscribed. Like, we 800 subscribers. Oh my god, thank you. If not the people, there's no I can have 100 subscribers. Thank you very much for subscribing and still coming back to my channel to watch my videos. Thank you, love you. My channel is all about tutorials, lifestyle, love, family, vlogs, and today we'll be talking about health talk. Without wasting much of our time, let us rush into today's business. In this video, I have my guest, a wonderful person, a special person today. So please meet my guest.
Hi guys, my name is Nurse Ituno, and briefly I'll be speaking about a very essential, very important topic that most people shy away from. Yeah, I see those cases all the time, but despite the fact that it is a case that happens all the time, people still shy away from it. People still don't talk about it, and that topic is no other topic than the urinary tract infection, also known as the UTI or the bladder infection.
Wow, UTI,
Yeah,
or the bladder infection.
If you don't call it the UTI infection, that is UTI, urinary tract infection, you can call it the bladder infection.
Wow. So guys, we'll be asking few questions. I'm talking more on this topic, and I know you learned from this. So ma, what is urinary tract infection? What is it? Like, we don't know it. Let's tell us about it.
Urinary tract infection is an infection in any part of the urinary system. It is an infection that occurs, that happens in any part of the urinary system. And what's this urinary system? The kidney, the ureter, and the bladder. So it is an infection that occurs in the urinary system, which is the kidney, the bladder, and the ureter. It is a very common type of infection. It is very common. It happens to anybody. It can happen to anybody.
No age. No age difference.
Man, woman, older adults, babies.
Wow.
But then, yes, children.
Wow.
You find it in children as well. Most adults, men, women, older adults, grandma, grandpa. So it has no age.
Wow.
No age limit. It's a very common infection. Very common. And then it has been said that you can find this infection more in women. It is mostly common in women.
But why is it common in women? Why?
Well, it is common in women because as a woman you have a ureter.
Okay.
And this ureter, it is the pipe, it is the tube that passes urine out of the body. So the ureter in women is quite short and closer to the anus. And due to this infection, microorganisms from the anus, like the E. coli bacteria, can actually penetrate into the body. So the reason why it is most common, or you can find it mostly in women, is because our ureter is quite short and closer to our anus
than that of a man.
That of men.
Wow.
Yes.
Wow. So women should be more careful than men.
Everybody should be careful.
Okay.
But then women are more likely to have this infection because their ureter is quite short and closer to the anus.
Wow.
Yeah. Then furthermore, urine typically does not have infections. Urine typically does not contain bacteria. Our urine typically does not carry germs. No. Urine is the byproduct of our filtrated system. It is a byproduct of our filtrated system. That is our kidney. Yes. So it does not carry bacteria. It does not carry germs. Okay. Our urine is always free from bacteria, always free
so
from
it's
germs.
as pure as water.
Yes.
You can drink it.
What? Bro, what are you talking about, man?
Are you serious?
Our urine is without contamination. No germ, no bacteria.
So now to ask, what causes this UTI when our urine is very very clean? Like, why are we having UTI in the first place?
Thank you. UTI, that is urinary tract infection, is caused by bacteria,
Okay.
by microorganisms. However, they can travel. They can travel to the ureter, down to our bladder, even to the kidney.
Straight.
Yes.
Oh, wow.
And causing serious problem, causing serious damage.
Wow, wow, wow. So how does the bacteria or the microorganism get to infect the urine? Like, how, in what process does it affect the urine?
Very good question. Germs can only get into our system from our outside body. Take for example, when we go to toilet, when we excrete, most women are fond of washing their private parts from the front, from the back to the front.
Okay.
It's supposed to be from the front to the back.
Okay.
Why? Because the anus has a certain bacteria around it. You know, for example, the E. coli bacteria can be found around the anus. So these are the kinds of bacteria that contaminate our urine, giving us urinary tract infection.
So, ma, what are the symptoms? Like, what are the things you need to know that, okay, this person has UTI? Or if someone else has it, well, okay, this person has so symptoms. What are the symptoms we have to look up to?
There are several symptoms of UTI.
Okay.
Urinary tract infection. But there's a particular one which is common. The UTI causes reddish and irritated private. It makes the private part reddish and very irritated. Very irritated. So, and other symptoms can include pain in the side.
Okay.
Pain in the side, in the abdomen.
Like side,
yes.
Okay.
Side pain. Pain in the abdomen, in the pelvic area. Just pain.
Just down here.
Pain on the side, the abdomen, the pelvic area. There are other several symptoms. If you don't pass through that pain, you can have pressure in the lower pelvic.
Okay.
Yes, pressure in the lower pelvic. Frequent need to urinate, painful urination. At times, blood in urine. The person can find blood stains in urine.
Wow.
Yes. So there are other symptoms like the urge to urinate frequently at night.
At night.
Yes, that person can experience the urge to urinate. Fine, people urinate at night, but person that has this UTI will always have the urge to urinate more frequently at night. Other symptoms can be urine color.
Okay.
Yes, abnormal urine color. Urine color might be a bit clouded, not clear. Clouded
like
urine
brown
color, something yellowish,
okay.
Unpleasant
color. Okay.
Another symptom of this UTI, foul smell.
Okay.
Urine tends to have foul smell, strong foul smell.
Like, it's very pungent.
Very unpleasant smell, a disturbing smell. So these are symptoms that the person who has UTI can actually experience. And other symptoms can be pain during sex.
Wow.
Yes. Pain during sex. UTI causes pain during sex. Yes.
Wow.
Fatigue is another symptom. Fever, another symptom. Vomiting, mental changes, confusion.
The symptoms are just...
there are lots of symptoms attached to UTI infection.
Wow. So that means you might even be having fever. You think that is malaria, or you just be like...
That is why it is very important to always seek medical attention before commencing treatment. That is why we speak against self-medication. You can feel feverish and just think it's normal malaria, and then it is not it. So these are symptoms of UTI: fever, fatigue, pain during sex, pain in the abdomen, the pelvic area, pain in the lower abdomen. So these are common symptoms of UTI.
Thank you very much for answering those questions. It was so educating. So now the next thing, like, what are the complications? Like, what can be the worst that can ever happen to someone that don't know he has this UTI? That can be like the extreme length of having UTI, like the complications. Can it cause something in the body, or what are the damages and complications?
And like
of
I
UTI?
always say, nothing is a death sentence. No sickness is a death sentence when discovered on time. When
even
discovered early. Nothing, no sickness actually is the death sentence when discovered on time, when treated on time, when attended to on time.
Okay.
So firstly, I would say urinary tract infection can be treated. But then what happens when it's not treated? What are the likelihood complications? What can happen? What is the worst thing that can happen when it is not treated? The worst that can happen to someone who has an untreated urinary tract infection is a serious infection in the kidney.
Wow.
Yes.
Kidney.
The kidney. Like I said earlier, the microorganisms that are responsible for UTI can travel up to the ureter, travel to the bladder, and up to the kidney. So when a person has UTI and doesn't give attention to it, doesn't go for treatment, or starts treatment and does not conclude them, or
so
at
that
a
means you
point
can start a treatment and don't finish it.
Yes, when you feel you are better or you feel relieved, there's no point taking those drugs. There's no point going for checkup. You've not treated it properly. You treated it halfway. So when a person does that, it is likely for that person to have a reoccurrence of UTI infection again. When you treat it halfway, or you don't treat it at all, or you treat it, you don't treat it well, there can be another reoccurrence of it. And when there's multiple recurrence, when it keeps happening over and over and over, that is when it becomes a problem.
Wow.
So the worst thing that can happen, the worst complication a person can experience is when this UTI affects the kidney. It gives the kidney another infection.
The whole kidney.
That I would not want to talk about. It is another topic on its own generally.
Wow. So that means we have to be very, very careful on treating this infection.
You must be careful. You must treat it completely. You don't treat it halfway. You must deal with it and terminate it completely once and for all.
Wow, this is very, very educative. Like, I've learned a lot just by hearing what our nurse is saying right here. Please clap for my guest. Thank you very much, ma. So I want to ask this question: what are the prevention? Like, what are the things we can use to prevent this infection?
There are several ways at which you can prevent yourself from having the UTI infection.
Okay.
Firstly, I would say personal hygiene.
Okay.
Have a personal hygiene. And this applies to both men and women. But I will emphasize on women.
Okay.
And the reason why I'm emphasizing on women is because our ureter is quite short and closer to the anus. And the E. coli bacteria can actually penetrate into the body, into the system, through that process.
Okay. Because
making
it's shorter
than that of men, making we more exposed to the infection. So I would advise women to have personal hygiene, improve your personal hygiene, work on your personal hygiene. Make sure you change your pads, your tampons, time to time. Make sure after emptying your bowel, you wash from the front to the back, not from the back to the front. Another way at which you can prevent yourself from this UTI infection is drinking plenty of fluids. Drinking plenty of fluids, especially water.
Yes. So what about other drinks like fruit juice?
That is why I said water. Okay. When I mean fluid, and I will emphasize on water. I will lay my points on water. And the reason is because there's nothing like water. Yes, so drinking of fluids, plenty fluids, would help. When you take more water, you have the tendency to urinate more. Okay. So when you urinate more, those bacteria can even have a way of coming out.
Okay, so if someone has this bacteria already,
Yes.
but if you are taking enough of water,
When you take plenty water, yes, you are telling those bacteria, please move out.
Wow.
Move out. So they tend to flow out with your urine. So drinking of plenty water would help you stay away
Drink
from.
plenty water.
You help remove extra bacteria from
Okay.
your urinary tract. When you take excess water, it helps remove excess bacteria from your urinary tract. Yes.
Okay.
Like drinking 6 to 8 glasses of water a day would help. So you improve your routine, your water routine. So another one is changing your urination habits.
Yeah. Is there something like that?
Yes, changing your urination habits. You change your urination habits.
Okay.
You don't need to sit and wait till you are very pressed before you pass out urine. Urination plays a very vital role in getting rid of bacteria from our body. So when you urinate often, you are getting rid of excess bacteria. So when you keep them, that means you are keeping bacteria. So it is very advisable you change your urination habits. When you take plenty fluid, which is water, less caffeine. Caffeine irritates the bladder. So that is why it is more advisable that the fluid should be water.
Instead of drinks,
instead of soda, instead of caffeine that irritates the bladder. Yeah. So it is advisable you take more fluid so that you have a good urination habit.
So people that tend to drink more of caffeine drinks,
citric juice, caffeine, spicy foods have effects on the bladder.
Ooh.
So the most preferred fluid is water.
So that means I can be taking all these caffeine, but I should take enough water.
Take 6
on that.
If you can take more than 6 glasses of water, you've improved on your water routine.
Wow.
Yes, so it is advisable you change your urination habit. Another way to prevent the UTI is changing birth control. Changing birth control.
Okay, like family planning.
God bless you.
Okay.
Changing birth control. It is always advised. We advise it all the time that before you get involved in using birth controls, it is advisable you see a doctor, seek medical attention before having a birth control. There are some birth controls that can expose you to the risks of having UTI. So it is advised you ask questions, see your doctor, run your test, ask questions often and often before embarking on any birth control.
So this is a very educating section with knows it to know. And I hope you also got 1 or 2. So please let us work on this infection. It's very, very common among everybody, both male and female. But for the female, please make sure you work on your hygiene and every other way of preventing this infection. Thank you very much, Nathan, for coming. I'm very honored to have you on my channel. Please, you are watching to this extent, don't forget to subscribe. You have not yet subscribed.
Please subscribe. If you've subscribed, please turn on the notification button. Like every video, leave a comment, share to your friends, family, loved ones, even if your enemy is around you. Please share.
Thank you for watching. See you in my next video. Bye.